So, Dr. Diggs, when do you find most women are asking for help? They're like, I can't take it anymore. Help me.
Well, so, I'm an internist and I'm a primary care doctor. And so women come to me with lots of different symptoms. I've got women in their 30s, and Dr. Vasavada and I kind of laughed about this, who'll come in and say, am I in menopause? Probably not. You're probably tired because you got toddlers, right? They're exhausting. But women will come to me with various symptoms. So we are all being inundated with media. I sort of call it the menopause industrial complex. And some women want to call every symptom, is it menopause? And sometimes I say, yeah, could be. What we know for sure is menopausal is hot flashes. So that's often a very common one. I'm soaking the bed, I'm getting flushed. That's a very common reason that people come. The other things that people come to me for, they may not even associate with menopause. It could be increasing in anxiety. It could be depression. It could be decreased libido. It could be, hair and nail changes, weight gain. And so they come with lots of different sort of non-specific. I think rarely do people say, I have menopause, give me hormones, right? It's much more of, I'm not feeling myself. Something's different. What's changing? And like Dr. Vasavada said, the way I practice is to listen and validate. Yes, there may be a medical reason. And I want to make sure it's not your thyroid. It's probably not your thyroid, guys. But I check. It's not your thyroid. There's not other things going on. And then really validate the normalness of this life transition, but also say, look, we also recognize that around menopause and perimenopause, it's the peak of, it's a really challenging time, right? Women may be very busy in their careers. They've got children at home or are launching. They may have aging parents that they're caring for. And so the timing could not be worse, right? To have all this pressure. And so a lot of it is validating what symptoms they're having, and then seeing what's reasonably possible to treat with medications or not.
And Dr. Vasavada, is it hot flashes normally is that the primary symptom that people come in?
Hot flashes, but as an OBGYN, irregular periods, heavy periods, vaginal dryness, decrease in libido, along with an increase in anxiety, weight gain, brain fog, skin and hair changes. You have estrogen receptors everywhere. And so I've seen plantar fasciitis, I've seen weird eczema. Who knows how it's affecting your body?
But it can be tied back to menopause.
Mm-hmm.